Welcome, Pharmacokinetics Elementary. Hi, everyone.
Hi.
Today's topic is drug excretion. Does anyone know the definition of drug excretion?
No.
Excretion is the removal of drugs from the body. Does anybody have any questions?
So how do we get medicine out of our bodies?
That's an excellent question. We have a fun dance to help you remember. Ready, you go.
Urine, bile, sweat, saliva, breast milk, expired air. Drug excretion. However, kids, the most important organ for drug excretion is the kidneys. So if you guys know anyone with kidney problems, they might have some issues getting the drugs out of their bodies. In other words, both the duration and the intensity of the drug's responses may increase.
Now let's talk about the 3 steps in kidney drug excretion. Step number 1 is glomerular filtration, which is when the blood flows through the glomerular capillaries, the fluid and the small molecules, including drugs, are forced through the pores of the capillary wall. So basically, it moves the drugs from the blood into the tubular urine. One important thing to remember is that large molecules are not filtered, such as drugs that are bound to albumin.
And step number 2 is passive tubular reabsorption. Basically, lipid-soluble drugs, or drugs that are big and fatty, move back into the blood, and polar and ionized smaller drugs remain in the urine so that they can be excreted or peed out.
Step 3 is active tubular secretion. So kids, there are active transport systems in the kidney's tubules that pump the drugs from the blood to the tubular urine. Tubules have 2 primary classes of pumps, organic acids and organic bases. P-glycoproteins can also pump a variety of drugs into the urine.
Now let's talk about the factors that change drug excretion. One is the pH-dependent ionization. This can be used to accelerate the renal excretion of drugs. So if nurses or physicians change their urinary pH, it will promote the ionization of a drug and therefore decrease passive reabsorption back into the blood. An example of this would be if someone took too much aspirin, we could treat them by giving them an agent that elevates the urinary pH.
Competition for active tubular transport is another factor. Renal excretion can be delayed when there are more than one drug in the body. This is known as competition for active tubular transport. So kids, when you're on the playground and you're waiting to use the slide and you're in line, this is exactly what happens when there are more than one drug in your body. If there are too many molecules present, some must wait their turn. Sometimes we use this method in the hospital to prolong the effects of drugs that normally undergo rapid renal excretion.
The third is age. So, hey Johnny, you have a new little brother, right?
Yeah.
Okay, well his kidneys are not fully developed yet. So he has trouble, unlike us big kids, on getting the medicine out of his body. Therefore, a nursing consideration would be that we should be very careful when giving little kids medicine.
And there are other non-renal routes of drug excretion, like breast milk. Therefore, mommies need to be careful with certain types of drugs.
Other non-renal routes include bile, lungs, sweat, and saliva.
Thanks, kids!
Thanks.
And don't forget our dance! Bye-bye!
Bye.